So responding to this challenge of embedding patient-centeredness in the way in which we design healthcare systems is essentially a cultural issue. It requires a cultural change. And as Mia has already pointed out, cultural change is a fundamental part of leadership. So I'm going to talk a bit now about why we should pay attention as leaders to patient-centred care and the ways in which some successful organisations have found useful things in addressing it. So to start with, why do it? It seems self-evident that providing the right care for the right patient at the right time is what we should be doing. And there are very obvious economic and ethical reasons for doing that. However, in reality, many decisions in healthcare are not certain. There's a lot of uncertainty in the way in which we need to make decisions so that the treatment or the outcome might look different depending on who is thinking about whether this is the right thing to do. So if we consider this, then we have to say that there are always going to be choices or trade-offs for both treatment and outcomes. For example, if we're thinking about outcomes, then is it more important to have a long life or to have good quality in the life that we have left? Or similarly, is it better to have a reduction in the symptoms that we have and trade that off against the side effects that the treatment might give us? And I think that the thing that's most important about this is that it is impossible to make those decisions unless you are the patient. It's not possible for a clinician to decide on the preference of long life versus quality of life. Indeed, it's not possible for the patient not to be involved. So we need to consider what ways do we have of making sure that patients' preferences are embedded in the way in which healthcare is delivered. Acting on patient preference is enshrined in the idea of shared decision making. And by that I mean the way in which we give appropriate information to patients in a way that they can understand, that we can support the decisions that patients make, so for example using option grids, and that we record and act on the preferences that they express. And the important thing about shared decision making is that informed and engaged patients make different decisions. They're more likely to adhere to treatment plans, they're more likely to choose healthy lifestyles, and they use less healthcare. So for example, if you think about benign prostate disease, we know that once a patient or groups of patients are well informed about the treatment options, they are less likely to opt for surgery. Because in reality, whilst you might reduce their urinary symptoms, actually many people post-surgery end up with sexual dysfunction, which is a least preferable outcome for them. Similarly, in cardiovascular disease, if you look at groups of patients, they are, once informed, less likely to look for surgical intervention. There's also a link between patient-centred care and clinical outcomes, so those domains of quality that I mentioned earlier, patient experience, patient safety and clinical outcomes, are all related to each other. The last bit that I think is important to remember about patient preference is that it's not just about the right decision for the right patient, but that actually sometimes if you don't take patient preference into account, you really end up with entirely the wrong decision. And there's a lot written recently about this idea of silent misdiagnosis. We don't find it difficult to think that it is a good thing to make a medical diagnosis and make the correct diagnosis. We perhaps don't think so often about what it means to make the right diagnosis in terms of the preference diagnosis, which is how the patient feels about it. And this can lead to not just costly mistakes in that we intervene when we don't need to, but also make a significant impact to the patient in terms of their experience of healthcare. So what does it take to set up organisations that are patient-centred? There's been quite a lot of work looking at the sorts of things that make a difference in terms of creating cultural change or creating organisations that are patient-centred. And it is largely not about individual initiatives. In order to change culture and make patients really the centre of the way in which we provide healthcare, then we need to embed that in a comprehensive strategic approach across the whole organisation. And there are lots of ways of describing how one might do that, and I think it's helpful to try and cut those down into sort of chunks, and there are essentially, I think, 6 ways that you can think about the sorts of things that organisations might do in order to embed patient-centred care. And that's to do with committed senior leadership, engaging patients and families, supporting staff, measuring and using patient experience data, being a learning organisation, and making sure that resources are available in order to create service changes that are responsive to what patients are saying about the healthcare they receive.